So thank you, Carlos. Yeah, so my name's Anika. I'm from A&P Inphatec, and I have been part of the company that's helped commercialize this product. And one of the important tasks for the company was to show how well this product works in real commercial vineyards. So I'll be going over our data, fresh, hot off the presses from last year at our commercial sites. So the first trial I'll be talking about was performed at Ridge Vineyards. It's been 3 years now that we've been performing this trial. It started back in 2017, where we first looked at all the vines and evaluated their disease state. And then we're just looking at the ones that were healthy back in 2017 and following disease and seeing what happened in 2020. So every year, the vines that were part of our phage treated group were treated 3 times with phage throughout the season. The control in this case is everything but the active phage ingredient. So these are our buffer controls, and they are also treated 3 times but without any phage in the treatment. And so every season they got treated 3 times and were evaluated for disease by either by both PCR and visually. In 2019, we actually improved our technique and started using qPCR and also doing visual symptoms. And what was great is that when you look in 2020, we're seeing a very different story between these buffer control vines and the treated vines, both with a qPCR technique and a visual. So in our treated vines, the Xylphi-pd treated vines, there were 74 vines and there were 91 buffer control vines. And if you look at our qPCR story, a few of these vines have died after 3 years. A few of them are showing severe infection, and we have a few of them that are showing early stage infection. Compared to the ones that were treated with Xylphi-pd, where there's now a 60% difference between these two groups, and the ones that were treated with Xylphi-pd, we have a few that are showing early stage infection, which just means there's a little bit of Xylella fastidiosa signal, but not a lot. In the visual symptoms mirror the same story. So we have a few of them that are dead, 3.2%. A few that are showing severe, and then you've got a number that are showing this like earlier stage symptom, looking at their foliar symptoms. But in the Xylphi-pd, again, you're just seeing a few of them showing this early disease state. Now we know that Pierce's disease affects fruit yield, and this is just emphasizing that fact. This is at this site, we looked at the fruit yield at every single vine in our study. So what we did was we parsed it out by how severe is the disease in the ones that were untreated. So this is 0, 1, 2, 3, and 4. And you can see that the fruit yield drops off dramatically once you have more severe Pierce's disease. You're losing over 50% of your yield compared to undiseased vines. And this is both 2018, 2019. So what does the fruit yield look like in 2020 after 3 years of Xylphi-pd treatment? We saw that on average, we're getting over 1 pound more fruit from the vines that were treated by Xylphi-pd, and this represents a 21% increase in yield due to, the lack of PD, the lack of death of vines, and variables such as that. Our other study that we started in 2019 was done in collaboration with our distribution partner, Wilbur Ellis. And in distributing our product, they really wanted to know how well it worked. So it was great to start an in-depth study to show in their customers' vineyards that we're really having efficacy. So this again, as in the last study, these are both natural Pierce's disease infections that we're treating. So this study was started in 2019 and 2020. There are 4 different sites that were used in Sonoma. This here is the Russian River, which is known to have a lot of riparian area that causes a lot of disease, and then one up north of Healdsburg. All the trial locations have a history of Pierce's disease and are located near or adjacent to a riparian edge. And the way this study was conducted is there are different groups. We have our controls. We have 2 different ones, a nearby and a far control. These are just vines that are not touched at all in the study and are monitored to look for how disease progresses. And then we have 2 treatment groups, one that was treated only in 2020 and one that was treated in 2019 and 2020. And a similar map to the last study that the treatment groups are here. So we've got the groups that were treated for 2 years, the vines that were treated for 2 years, the ones that were treated for 1 year, and the ones that just were not touched except for disease evaluations in 2019 and 2020. Now this study is a little different from the last study. We don't know how the vines entered the study, how diseased they were, because we didn't actually go out in 2018 to measure their disease state. It's impossible, as far as I know, to measure the disease state in spring. So we went into it just saying, we know that there's disease in these areas. Let's just try to choose vines at random and then treat them and see what happens. So in this study, I'm showing you the year-on-year data from the fall of 2019 and fall of 2020 to show the reduction of disease from over that year. So in the untreated, there actually is a reduction in disease from 2019 to 2020, and that's because there wasn't a large increase of Pierce's disease pressure. And there are other things that the vineyards are doing to try to keep doing vector control and whatnot. So you can actually see a slight reduction of disease in any 1 year. But if there had been a large pressure, a large new infestation, infestation of sharpshooters that brought new XF in, then you would have seen this likely increase. But if you compare the untreated to our treated groups, you'll see that the treated groups fared much better. So there was a much better, much more recovery from disease in our 1 year, and in particular our 2-year treated vines. There's a 60% drop here in this 2-year treated group from 2019 to 2020, both by qPCR and visually. And so the conclusion from this study is that by both visual and qPCR diagnosis, we're seeing that Xylphi-pd is causing much more reduction of disease as compared to our untreated groups. So just wanted to go another minute or two on exactly how we use our product and its application as it relates to these studies, because we followed our label. So in the Xylphi-pd program, to use this product, what you do is you look for bud break, and the first application is 6 to 8 weeks after, followed by 2 more applications 4 to 6 weeks following. For mature vines, you inject into each cordon and once or twice into the trunk, while for young vines, you just need to inject into the trunk. And our bottle, one of our bottles will treat about 100 vines per season. Mature vines, if you're doing young vines, it's actually about 200 vines. And our use is both as a preventative or as a therapeutic after disease symptoms have become visible. And really, we're going for when conditions may lead to disease pressure. So you want to treat places that have a high PD incidence, including the currently asymptomatic vines, because how long it takes for a vine to be infected with XF and die. It shows symptoms a year or 2 after it's already been infected. So you actually have to treat ones that you may not know are already infected yet. And so we recommend treating riparian areas in places with high sharpshooter counts. There are a few different scenarios for using our product. So if you know you have this one vine here is infected with Pierce's disease, then you can treat just the bordering vines around it. There's this kind of hotspot model as to how the disease progresses. But other ways we like to use it are buffer zones. So if you've got a riparian area, you can just treat all along that area of the vines that border the riparian area. If an entire area was replanted because of Pierce's disease, then you could treat those new replants to protect them from the new infection coming back through. Or if you've got something like a glassy wing sharpshooter, you might want to treat the entire block because it does move the disease further away, and it's a little bit harder to predict. So here's our label, and just an emphasis on the fact that we are approved for organic production, which we're very proud of. So in summary, as Carlos showed you quite in depth, we have found, or he has found, the first virulent phages discovered against Xylella fastidiosa, and they are now available in a commercial product, Xylphi-pd, which is an organic product. And you've now seen academic and just a portion actually of the data we have from academic and commercial vineyard trials demonstrating preventative and therapeutic treatment for Pierce's disease. So I'll stop here, but just a quick acknowledgements of our parent company, Otsuka Pharmaceuticals, and our partner, Ridge Vineyards, as well as, of course, Texas A&M, CPT, and the scientists, all of the scientists that has made this possible, from Wilbur Ellis, Texas A&M, A&P Inphatec. So thank you for your attention, and we'll take questions.